Hi, this is Reena Jadhav here at Vator Health, and I'm excited to be hanging out with Peter Hames with Big Health. How are you?
Very good, pleasure to be here.
You're doing some really exciting things in digital medicine. Tell me a little bit about what you do.
Yeah, so we are a digital medicine company. What that means is we're taking evidence-based non-drug therapies like cognitive behavioral therapy, automating them and thereby making them as scalable and consistent as drugs, which is why we call it digital medicine.
Give me an example.
So our lead product is called Sleepio.
Okay.
It's a digital sleep improvement program which acts, although it's ostensibly about sleep, it acts as a destigmatized Trojan horse to address wider mental health. So whereas people will perhaps be reticent to engage in depression and anxiety, sleep problems are a very good predictor of those issues, and a topic that people are much more likely to engage with. And so the solution itself, you access it via web and mobile, all presented by your virtual animated sleep expert, the Prof, and his narcoleptic dog Pavlov, who leads you through the program. And the great thing is that, like any medicine, we have to show it works.
Yeah.
And so we now have 18 peer-reviewed papers, including 5 randomized control trials, which show that it is as effective as face-to-face therapy in addressing sleep and secondary outcomes of
That's
mental health.
remarkable.
Yeah.
So what is the secret sauce? How are you pulling that off?
So I think, so point one, we have, we're standing on the shoulders of giants. We have an enormous body of evidence and literature which has now over decades shown the core approaches that are super effective if delivered correctly. So that's point one, is that we're basing what we do on the world's best experts.
Okay.
The second point is that is all irrelevant if people don't actually do it.
Exactly, exactly, and that's been the number one problem with sleep solutions.
Yes, this is it.
Unless it's a mattress.
Yeah, that's it, unless you literally lie down on it. And so I think that generic challenge of behaviour change is one where we spend a lot of our energies, and as I've already mentioned, making this feel something human, like feeling that although it is fully automated, it is very, very relevant to you in the given moment, is critical for us to create that engagement and trust, which ultimately leads to the outcomes that we've seen.
And is this something that you track other data as well to personalize it? Is it sort of personalized sleep schedule? Or is it a little more generalized?
Oh, very, very hyper-personalized.
Okay.
And
how do you do that?
Yeah, so we will, we do not detect or track the data ourselves.
Okay.
We are the therapy layer, if you think of it that way. So we are integrated with HealthKit, with Fitbit, we're agnostic as to where we get that data from, but we can import it, and the Prof will use that data to personalize your program between which technique he gives you, through to exactly as you say, like what is your precise optimal sleep schedule for that coming night.
So it includes reminders and meditation and
all of that.
Get right back to bed right now. Okay.
No, so exactly.
Right? Like if I wake up at 3 a.m., does it buzz me? So now you're training me not to wake up because it hurts when I do.
I wish it worked like that way. But unfortunately, it's
not that simple.
It's not that simple. But as you say, all of those things you describe have a role to play. Okay. So in reminders to trigger you to a certain behaviour is key, and different people react to different types, different tones and modalities of reminder. Okay. But for me, the key is all of these things working in concert. It being personalised in a number of different strata. And I think that we made good progress towards that, again, as evidenced by the clinical evidence.
Right. And I think that's the biggest challenge, is that so many people are attacking the sleep space because it is such a problem, big problem, and to your point, it can be the driver towards mental illness, anxiety, weight gain. I mean, there's so many other illnesses that start on the foundation of bad sleep or sleep. So the question is, how do you stand out, and how do you become a medicine versus a toy, or like a fun app that I try and then I stop using?
It's a great question, and I think that you strike upon the core challenge at this very early, exciting, nascent stage of what we call digital medicine. The acknowledgement that although the method of delivery is an app or a website or some sort of digital means of delivery, that doesn't mean that it is a toy or a game. That it can deliver outcomes as good as or better than the best current standard of care. And so that, for me, the key to that is evidence. As I've already said, we have put a lot of time and work in to build what I am confident is the strongest evidence base in any digital therapeutic.
Okay.
And I think that that's been born out of our very DNA as a company. So my co-founder is a guy called Professor Colin Espy at the University of Oxford. It's his book that I used to cure my own insomnia.
Is that how it started? Is that the genesis of the startup idea?
Yes.
Is I solve my problem first?
Exactly. So I use this book, pretty manual, it's a great book, chapter a week, cured me in 6 weeks.
Wow.
This is amazing. Put on a suit, went up to Glasgow and got him on board. So he's
my co-founder.
So
what a great story.
Yeah, thanks. so that is his presence that has really made evidence collection like central to what we believe is important in achieving what you say, which is, how do we shift perception in the mainstream medical community that these aren't toys, these can be medicine.
Right. How much money have you raised?
So in total to date, $15 million.
50.
15.
15.
Yeah.
Okay. That's still significant for the space you're in.
Yes.
So for the entrepreneurs in the audience, talk a little bit about how did you do that? What did you need to do to raise that kind of money?
Yeah, so we, I think that in health it's a challenge.
Yeah.
Because the growth cycles are slower, there's more regulation, the barriers in getting access to the market are greater. And I think that, I view that as a sort of very noble Rubik's Cube to solve.
Yeah.
And so in that context, you really have to, as with any startup, I think, like find investors who are partners and sort of along for the whole ride.
Yeah.
And we're very lucky that we have investors in from the healthcare world, so Kaiser Permanente Ventures, through to representatives from the consumer technology space, with a much bigger presence in consumer technology, like Index Ventures.
Okay.
So I think that different individuals will react and engage with different aspects of the mission that you're going on.
Yeah.
But I think from an entrepreneur perspective, the key is to get a balance of perspectives and experience.
What was it that allowed you to raise your last big round? Was it that you delivered the clinical trial results? Or the trial results?
Yeah.
Okay.
Oh, so
that's the key.
No, so we have had a pipeline of evidence since our earliest days.
Okay.
I think that a big factor in this instance has been actually putting this into practice. So actually being able to show that...
Getting real customers.
Yeah, getting real customers and getting this out to the people who need it.
Well, what's your attrition rate? Because that's one of the biggest challenges on mobile.
Yeah, so I can't talk about it.
Of course you can. I had to ask.
Yeah.
Is it industry standard?
I don't know, what is industry standard?
50% in 3 months?
I can't talk to that. But what I can say is that, and this is what we optimize for, is is outcomes. So if you think about one of the great opportunities with digital medicine is that we can break that traditional medical model, which says, pay me for treatment, and therefore I'm incentivized to give you as much treatment as possible forever. And that's the way drug companies work, it's the way all providers work.
Yeah.
Because we have the data, we have an opportunity to say, actually, our payment should be connected to outcomes. And actually, patients...
What a concept!
What a concept! It's like patients want to have the minimum treatment necessary to get better and get back to their lives.
Right.
And I think that in that context, our evidence speaks to that, what outcomes we're able to deliver with the solution.
So when you treat someone completely, like yourself, right, and no longer have insomnia, I sleep like a baby, does that mean your job is done as big health? And in that case, are you looking at, hey, what other problem can I solve using the same mechanisms? Or talk to me a little bit about that sort of lifetime value of the customer.
Yeah, really good question. And I think that this relates, I think this is why business model is so critical in making digital medicine something which becomes a mainstream reality and is a scalable and sustainable industry. For me, our customers right now are payers. So in the broader sense, so self-funded employers and doing increasing work with actual health plans.
And is Kaiser a customer given that they are also
we're doing a lot of work, we're doing a lot of work with Kaiser. The industry sides are kept quite separate, quite rightly, but we're doing a bunch of really interesting work with Kaiser. And so in terms of thinking about the value of an individual, it's the value of those outcomes. And so, what the patient wants is minimum treatment, get well as soon as possible. We should be incentivized to do that as well.
Yes.
And so even though I think that we can, over time, have a sustained relationship with the people that we help, the intention and the drive is for them to perversely kind of not use it. You shouldn't. We want you to not need this, you know. And so it is much more of a curative model. You know, that is the model. And the good, you know, there's enough mental health issues. You know, so many mental health to go around.
Absolutely. I mean, that's my thought is that wouldn't you want to progress from sleep to then truly addressing those mental issues during the day? Because sleep is one aspect of my day, but then there's other aspects of my day that might influence my sleep. So you grow into mental health, and is that something you're doing now or planning on doing?
Absolutely. So we are looking at wider focus on other mental health issues, and as you say, like the great starting point from sleep is a great place to begin.
Yeah.
As you say, it is a sort of foundation, like a sort of horizontal, not vertical. So that it touches everything. Everything touches it. Yeah. And so I think that we are looking to learn from that experience to go, actually, the prof in his animated world, how can his skill, can his skill set evolve to be able to help you with a wider range of issues.
Right. For example, maybe sensing cortisol during the day based on one of the variables I've got. Yes. And knowing that's not going to let me sleep tonight, or maybe it's my caffeine, or very exciting. So 5 years from now, you're hugely successful. What does that mean for the world? Are we all sleeping like babies? Or?
Everyone is asleep 24 hours a day.
I love it.
The animals take over the seats again.
That's right. That's right, Colin.
Yeah.
That's right.
No, so I think that for me, end game here is for digital medicine to be as ubiquitous as pharmaceutical medicine. Right? So I think many folks at this conference won't see this as that revolutionary and quite simple, but for me, this is where the magic lies, which is everyday people going onto the App Store, finding a set of Kaiser or NHS endorsed apps, installing them for free, entering their member number, using them, and then hopefully getting better, and without any doctors or health professionals involved. And the providers, us included, our reimbursement being deeply connected to the outcomes that we deliver. And so I think that relatively simple model, I think, would at a stroke address, like I said, 80% of the issues that we see in certainly care of chronic conditions in terms of alignment of incentives, and what's attractive to me is that we can build collectively a huge industry, big companies that are very profitable, but only by literally curing millions of people.
Right. Exciting.
And that for me is the thing that gets me out of bed.
Yeah, absolutely. Exciting. Thank you so much for sharing.
Thank you.
Appreciate it. Enjoy the conference.
Pleasure. You too. Thank you very much.